Hello, today I'm going to perform a head, eyes, ears, nose, throat, and neck exam. And first I'm going to start with the head. And with the head, I'm going to inspect and palpate um, the scalp, the hair. I'm looking for any abnormalities, any lesions, any signs of trauma, protrusions. Next, I'm going to ask my patient if he can feel my hand. Yes, feel my hand, great. And also, I'm looking for any asymmetry. And I'm gonna ask my patient to smile for me. Smile. Show me your teeth, please. And also wrinkle your forehead. There you go. And then what I'm assessing is for any anomalies with the cranial nerves. Next, I'm going to check for my pupils and for my eyes. And what I'm doing with my eyes, first I am going to shine a light and assess for pupillary response, and both pupils react. What I'm looking for if they are equal and reactive to light, and also we're going to check for accommodation, right? And also if they're consensual, and they are. And I'm going to shine my light, and they are symmetrical. Next, I'm going to inspect the conjunctiva, and nice and pink. And what I'm looking for is if there's any signs of infection, any exudates, any discharge. Also for color, if they're paler, if they have paler, or if they're pink. In this case, they're pink. Also, I'm going to ask my patient to move my eyes. Please move my eyes to the right. I'm also looking for any discoloration around the sclera. And also, I'm going to check for extraocular movements. And we're going to do the 6 points of cardinal gaze. Please follow my finger. In this case, extraocular movements intact. Um, Also, I'm going to palpate for the lacrimal glands. And we're also doing a visual acuity as well. And I am going to ask my patient. We can either do the Snelling or the Rosenbaum, but we have actually Rosenbaum, and I'm going to ask for my patient to close the right eye and tell me what's the number farthest that you can read. 4, 2, 6, 7, 3, 8. 2020. Also to the left. Oh, sorry, other one. 4, 6, 8, 7, 3. And then with both eyes open. 4, 4, 2, 6, 7, 3. In this case, my patient has 20/20 vision. Next, I'm going to do my red reflex exam. And, I'm going to ask my patient to remain still. And what I'm looking for is any signs with macular degeneration, any tortuosity of the vessels, if I can see the optic disc in this case. Present. Next, I'm going to go ahead and inspect my ears. And with the ears, first I want to ask my patient if he can hear me, and I will do the whisper test. And I want you to tell me what's the word that I'm telling you. Alcohol. Mint. And I will use the tuning fork test also. vibration? Yes. And we're checking for any hearing deficits. Um, for any hearing deficits or any issues with hearing loss. Next, I'm going to inspect, see if the patient has any pain, not any pain. Check the tragus, the helix, the anti-helix. Going to go ahead and perform an otoscopic exam, and I'm going to ask my patient to remain still, and I am going to pull the ear up and back, and for an adult, and for a child, we're going to pull the ear down and low. So, and what I'm looking for is if the patient has a bulging tympanic membrane, if I can visualize the auditory canal, and if I can identify the light reflex and also the bones within the structures. And it's nice and pearl white. And so let's do the same thing for the left ear. And, no signs of trauma, no signs of infection. There's no discharge, no drainage, and no earache. Next, I'm going to assess my nose. And with the nose, I'm going to ask my patient to tilt the head back a little bit. And I'm going to check each nair. I'm also going to ask my patient if he has had any trouble with the sense of smell. Any sense with the smell? No problems. Okay. And with the nose, what I'm looking is any problems within the structure, any deviated septums, any perforated septum, any signs of infection, allergies, any polyps, any trauma. In this case, patient is with a normal exam. Next, I'm going to check the mouth. And with the mouth, I am going to ask my patient to ask him if he has any dentures. If he has any dentures, we need to take them out. Thank you. Please open your mouth and say ah. Okay, I can visualize the uvula. I can see the tonsils. And also I'm going to look at the roof of the mouth. I'm going to inspect the soft palate, the hard palate, and it's nice and pink. And I'm also going to, and that says for cranial nerve function 9 and 10. With the right guide reflex, but I'm not going to do it on this patient. So I'm just looking. He does have the guide reflex. Sorry about that. I'm also looking for the teeth. If they're all there, there should be about 32 in the adult. And I don't see any signs of tooth decay. The gums look healthy. I don't see any spots, any signs of trauma, any signs of infection. Also, I'm going to ask my patient to close the mouth, show me the teeth, and I'm looking for any malocclusion. He doesn't have it. Next. Well, I don't want to forget, have you had any changes within the taste lately or any problems with taste? Okay, that's very important. Next and last, we're going to check for the neck. And with the neck, I'm going to inspect and palpate. I'm looking for any trauma or any signs of infection, any problems. Also, I'm going to check for JVD, jugular vein distension, common in heart failure patients or trauma patients as well. And in this case, it's nice and flat and normal. And I'm going to ask my patient, I'm also going to assess for cranial nerve function. Please shrug your shoulders for me. That's good. And also move your neck to the left, to the right. Tilt your head backwards. Tilt your head forward. Okay. And going to assess for thyroid gland. And I'm going to come from the behind, and then I'm going to palpate over the periphery and looking to palpate for the isthmus. I'm also looking to see if there's any bulging. any tortuosity. And I'm also going to ask my patient to swallow. Oh, okay. There's no bulging of the thyroid, all indicative of hyperthyroid or thyrotoxicosis or any of those conditions. Thank you very much for watching my video.